Hi Cheryl, thanks for coming. Today's visit, as you know, we're going to talk about the diagnosis and what we figured out after our first visit. It looks like, based on the physical exam, based on your symptoms of the stiffness in the morning and the pain in the hands, wrists, feet, the new onset, I mean, this started recently, the fatigue, and the blood test, and when I examined you, finding those swollen joints at the wrists and the balls of the feet and the fingers, that the diagnosis is rheumatoid arthritis. I'm very sure this is our diagnosis, and it explains everything.
So I know I'm not a spring chicken, but that's an old person's disease. So how can that be?
It's a common misconception that there's only one type of arthritis, which is an older person's arthritis. That's called osteoarthritis, and it can happen very commonly in many of us, and it's more common as we age. But you have a different type of arthritis. This is nothing to do with osteoarthritis. This is rheumatoid arthritis.
So how do I get rid of it? I mean, is this something I'm going to have forever, or is it going to go away in a couple of weeks, or what?
Well, if we talked about this 20 years ago, we'd be saying forever. But now, and with you, because we've caught it early, we can treat this and get it into remission. So that remission meaning that you're feeling completely normal again. The faster we do that, the more we could avoid any damage to your joints.
Do I have to take stuff to make that happen?
Yes.
Am I going to have to take meds?
Yes, there are medications that we will have to use at the beginning. It'll be a bit stronger at the beginning to get this under control, and then we can back off on them as you're doing well.
Okay, I think I understand. It's pretty crummy news.
You know, you could look at it as crummy news, but the fact is it explains what you have, and we have a way to manage it. So sometimes I think of it as good news. We know exactly what we need to do.
So before all this stuff started to happen to me, I was, pretty good athlete. I have a ton of pressure on me. I have a high sort of pressure job, and I live alone. It's a lot to take in.
It's a big shock to get a diagnosis like this. It's natural to feel a lot of anxiety and some depression symptoms. This is the worst you're going to feel. We're going to make you a lot better. You're going to look back on this and remember how you got through this.